Hello and welcome everyone. Myself Mijanur Rahaman and welcome back to my channel. In the previous video, we are already discussing about the applied physiology part of the disorders of pituitary gland. In that video, we have already discussed the hyperactivity of anterior pituitary, and in that part, we have discussed about gigantism and acromegaly, then acromegalic gigantism, and the Cushing disease. Now we will discuss about the hypoactivity of anterior pituitary. So first of all, the disease which is known to us is dwarfism. Dwarfism is a pituitary disorder in children characterized by the stunted growth. Now the causes of this disease. Reduction in growth hormone secretion in infancy or early childhood causes dwarfism. It occurs because of the following reasons. There are certain regions like tumor of the chromophobes. It is a non-functioning tumor which compresses and destroys the normal cells secreting GH. It is the most common cause for hyposecretion of growth hormone and leading to dwarfism. Second, deficiency of growth hormone releasing hormones secreted by hypothalamus. Third, deficiency of somatomedin C. Fourth, atrophy of or degeneration of eosinophilic cells in the anterior pituitary. And the fifth, Panhypopituitarism. In this condition, there is a reduction in the secretion of all the hormones of anterior pituitary gland. This type of dwarfism is associated with other symptoms due to the deficiency of other anterior pituitary hormones. Now, sign and symptoms. Primary symptoms of hypopituitarism in children as the stunted skeletal growth. The maximum height of the anterior pituitary dwarf at the adult age is only about 3 feet. But the proportion of different parts of the body are almost normal, only the head becomes slightly larger in relation to the body. And the pituitary dwarfs do not show any deformity and their mental activity is normal with no mental retardation. And the reproductive function is not affected if there is only GH deficiency. However, during panhypopituitarism, the dwarfs do not obtain pituitary due to the deficiency of gonadotropic hormones. In this case, the panhypopituitarism, the gonads does not function proper because of the lack of the gonadotropic hormones, not because of growth hormone. So now Laron dwarfism. Laron dwarfism is a genetic disorder. It is also called growth hormone insensitivity. It occurs due to the presence of abnormal growth hormone secretory GHS receptors in liver. GHS receptor become abnormal because of the mutation of the genes for the receptors. Now growth hormone secretion is normal or high, but the hormone cannot stimulate the growth because of the abnormal GHS receptor. So dwarfism occurs. Then psychogenic dwarfism. Dwarfism occurs if the child is exposed to extreme emotional deprivation or stress. The short stature is because of the deficiency of growth hormone. This type of dwarfism is called psychogenic dwarfism and psychosocial dwarfism or stress dwarfism. What is the reason of this the dwarfism? The dwarfism occurs if the child is exposed to extreme emotional deprivation or stress. The short stature is because of the deficiency of growth hormone. This type of dwarfism is known as psychogenic dwarfism. It is also known as psychosocial dwarfism or stress dwarfism. Now, dwarfism in dystrophia adiposogenitalis. Now, dystrophia adiposogenitalis or Froelich syndrome is a pituitary disorder. Dwarfism occurs if it develops in children. And dwarfism in panhypopituitarism. Panhypopituitarism is the pituitary disorder due to reduction in secretion of all anterior pituitary hormones. These dwarfs do not attain puberty. Now, second disorder is acromegaly. Acromegaly is a rare disease in adults characterized by the atrophy of the extremities of the body. Causes deficiency of growth hormone in adults causes acromegaly. This secretion of the growth hormone is decreased in following condition: deficiency of growth hormone releasing hormone from hypothalamus, atrophy or degeneration of the acidophilic cells in the anterior pituitary, tumor of the chromophobes. It is a non-functioning tumor which compresses and destroys the normal cells secreting the growth hormone. This is the most common cause for hypersecretion of the growth hormone leading to acromegaly. Now, panhypopituitarism, it is the same case. In this condition, there is a reduction of secretion of all the hormones of the anterior pituitary gland. Acromegaly is associated with other symptoms due to the deficiency of other anterior pituitary hormones. Now, signs and symptoms. Atrophy and thinning of extremities of the body. Hands and feet are the major symptoms in the acromegaly. Acromegaly is mostly associated with the hypothyroidism and hyposecretion of adrenocortical hormones also. It is also called acromegaly. The person becomes lethargic and obese. There is loss of sexual function. Next, Simon disease. Simon disease is a rare pituitary disease. It is also called pituitary cachexia. Causes. It is occurred mostly in panhypopituitarism, i.e., hyposecretion of all the anterior pituitary hormones due to the atrophy or degeneration of anterior pituitary gland. Symptoms. A major feature of the Simon disease is the rapidly developing senile decay. Thus, a 30-year-old person looks like a 60-year-old person. The senile decay is mainly due to the deficiency of the hormones from the target glands of the anterior pituitary, like the thyroid gland, adrenal cortex, and the gonads. There is loss of hair over the body and loss of teeth. Skin on the face becomes very dry and wrinkled, so there is a shrunken appearance of facial features. It is the most common feature of this disease. Now, hyperactivity of the posterior pituitary. Syndrome of inappropriate hypersecretion of antidiuretic hormone or SIAD. SIAD is the disease characterized by loss of sodium through the urine due to hypersecretion of ADH. Now, causes. SIAD occurs due to cerebral tumors, lung tumors, and lung cancers because of the tumor cells and the cancer cells secrete ADH. In normal condition, ADH decreases the urine output by facultative reabsorption of water in distal convoluted tubule and the collecting duct. But the urine that is formed in the concentrated form with sodium and other ions, loss of sodium decreases the osmolarity of plasma, making it hypotonic. And hypotonic plasma inhibits ADH secretion, resulting in the restoration of plasma osmolarity. However, in SIAD, secretion of ADH is from tumor or cancer cell is not inhibited by hypotonic plasma, so there is a continuous loss of sodium, resulting in persistent plasma hypotonicity. Now, signs and symptoms: loss of appetite, weight loss, nausea, vomiting, headache, muscle weakness, spasm, cramps, fatigue, restlessness, and irritability. In severe condition, the patient die because of the convulsions and coma. Now, hypoactivity of the posterior pituitary. Hypoactivity disorders are diabetes insipidus. Diabetes insipidus is a posterior pituitary disorder characterized by excess excretion of the water through urine. Causes. The disorder develops due to the deficiency of ADH, which occurs in the following condition: lesion, injury, or degeneration of supraoptic and paraventricular nuclei of hypothalamus, lesion in hypothalamo-hypophyseal tract, atrophy of posterior pituitary, inability of renal tubules to give response to ADH hormone. Such condition is called nephrogenic diabetic insipidus. So, what is nephrogenic diabetes insipidus? Inability of renal tubules to give response to ADH hormone. In this case, it is known as nephrogenic diabetes insipidus. Now, signs and symptoms. Polyuria, excretion of large quantity of dilute urine with increased frequency of voiding is called polyuria. Daily output of urine varies between 4 to 12 liter. In the absence of ADH, the epithelial cells of distal convoluted tubule or DCT in the nephron and the collecting duct of the kidney become impermeable to water. So water is not reabsorbed from the renal tubule and collecting duct. It leads to loss of water through urine, and it is a huge loss of water, 8 to 12 liter of almost. Now polydipsia. Intake of excess water is called polydipsia. Because of polyuria, lot of water is lost from the body. It stimulates the third center in the hypothalamus, resulting in intake of large quantity of water. Number 3, dehydration. In some cases, the thirst center in the hypothalamus is also affected by the lesion. Water intake decreases in these patients, and the loss of water through the urine is not compensated. So dehydration develops, which may lead to death. And nephrogenic diabetes insipidus, it is a genetic disorder due to inability of renal tubules to give response to ADH. It is caused due to by the mutation of genes of V2 receptors or aquaporin 2. Now, hyperactivity of anterior and posterior pituitary. The disease is known as dystrophia adiposogenitalis. It is the disorder of both hypoactivity of anterior and posterior pituitary. Now, dystrophia of adiposogenitalis is a disease characterized by obesity and hypogonadism, affecting mainly the adolescent boys. It is called frolic syndrome or hypothalamic eunuchism. Now, causes. Dystrophia adiposogenitalis is due to hypoactivity of the both anterior pituitary and posterior pituitary. Common causes of this disease is a tumor in pituitary gland and hypothalamic regions concerned with food intake and gonadal development. Other causes are injury or atrophy of the pituitary gland and genetic inability of hypothalamus to secrete luteinizing hormone releasing hormone. Now, signs and symptoms. Obesity is the common feature of this disorder. Due to the abnormal stimulation of feeding center, the person overeats and consequently becomes obese. Obesity is accompanied by sexual infantilism, failure to develop secondary sexual characters, or eunuchism. Dwarfism occurs if the disease starts in growing age. In children, it is called infantile or prepubertal type of frolic syndrome. This disease develops in adults also. When it occurs in adults, it is called adult hyperprolic syndrome. In adults, the major symptoms are obesity and atrophy of sex organs, and other features of this disorder and behavioral changes and loss of vision. Some patients develop diabetes insipidus. So this is for now. We have already completed the disorders of pituitary gland. We have already discussed the anterior pituitary disorder, posterior pituitary disorder, hyperactivity, hypoactivity, and the both hyperactivity disorders. So thank you for watching. Do like, share, and subscribe for supporting me and my channel. Thank you for watching.